Hello, I'm Dr. Lali Pataredze and we are in EuroMed clinic in Dubai. Welcome to us. Today I would like to speak to you about diabetes. Diabetes is actually in Dubai quite common. Diabetes in children about. First of all, I would like to explain to parents this is not something very dangerous, you cannot handle it, and we should accept it for a child as another type of life. It is still, he can continue normal life, but should be under control of the doctor, of course, always. And the whole family should help to this child to handle his diabetes. Appropriate diet, maybe parents also should keep themselves on diet, and appropriate management. First, it should be at the hospital to give proper dose and to control it at the hospital with your endocrinologist, and then just to teach the baby how to accept it and how to handle easiest way for diabetes to be treated. Main things is, of course, your help. It's very important communication between doctor, parents, and the child, our patient. So which finally will be good for the child to get proper treatment. Treatment, activities, diet, all these things you always can discuss with your endocrinologist. It will be very useful, of course, even with your pediatrician. Because if something will be wrong, pediatrician will understand something goes wrong with the treatment, or you need to increase the dose, or you need to decrease the dose of medication, then it's always good to be admitted at the hospital and go by proper way to make right dose. You know, if child is already, we know the diabetic, and he is on medication, most probably we can have hypoglycemia, low sugar. It is very important, do not miss this moment and to adjust the right dose. If he, for example, missed his food and he had given more insulin, this is important moment. Do not have hypoglycemia, and child always should have some chocolate or piece of some sugar, something sweet with him in these cases, at this moment. But of course important is when child is getting sick. If he's just some common cold or any other diseases, it also can aggravate diabetes. At this moment, if you see that your child is not well, having high fever, also I will advise you to go and seek help of your pediatrician or your endocrinologist who is following your child. If you see that suddenly child is not feeling well, then and he is already on insulin medication, so if it is possible, first step, check with glucometer level of his sugar and give him something sweet drink or some piece of chocolate. And the next step, please take him immediately to the hospital. Do not risk baby's life. As I talked about it earlier, if a child is diabetic, we know, and he develops some fever or some infectious sore throat and any cold and some infectious diseases, so this is also important moment with dosage. Regulate the dose. It might be difficult for you. So again, he should be with at the hospital or with his pediatrician or his endocrinologist who is following the patient, because those should be adjusted at this moment as well. Exactly. Child with diabetes, always we can expect from them and explain them. They can have normal life if they are following very carefully all investigations and all medications. Please be careful about prophylactic of make checkups every year for kidney functions and eyes. This is very important for diabetic patients. Do not miss, do not have long-term damages in vessels. Do not have long-term damages in vessels. Please always be careful and go for prophylactic checkups for kidney functions and for eye vessels.